Hello and welcome to the training video for the Microbiome Life test. My name is Meg. I'm the Wellness Director of Biome Technologies. We are the company behind powering this amazing and very cool product. And I want to help anyone watching this today understand a little bit more in depth about how to talk to your customers and clients about this test. I want you to feel well prepared to jump on a consult with somebody and feel good about helping them and answering their questions. So this video is geared toward healthcare professionals who are planning on talking to customers and clients about this product. And I'm going to go through the test one section at a time first. I think it's good to just kind of get a clinical overview of what we're looking at and what we're talking about within this test. And then I will pull in some specific examples so we can kind of tie it all together, and you'll be leaving with some clinical pearls. So let's start with at the top here. The top section that we're looking at is a really good overall view of where your customer or client stands, or where their sample stands compared to the norm, essentially. And the norm is defined by tens of thousands of data pieces that we have collected over the years, and that Dr. Ghanum, who's the founder of Biome Technologies, has access to over the years. It's a huge compilation of data sets from real human examples, and we've been able to find patterns within that data set over the years that of what constitutes, quote, health, which essentially we're defining as people without digestive symptoms, people who have really good habits. And we've been able to bring that information to use as a model to bring forward this type of product, to really put customer and clients' wellness in their hands. So what we want to know, or something that's really important to remember when you're talking to customers and clients about this test, is that this is not a diagnostic test. It's a wellness tool. So when you're utilizing this, for those of you that are familiar with working in a functional nutrition or functional medicine space, this will feel very familiar to you, because we don't, in that space, it's common we're not working with diagnostics. We're working based off of information the customer, or the patient in that case, is telling us, and biometric data that we have available to kind of tie conclusions. We're working in the in-between space between healthy and ill. It's a state that many people refer to as dis-ease, just meaning you do not have a diagnosed condition that you may want to see a medical provider for, but you are experiencing symptoms and things that are uncomfortable. So we're dealing with imbalances. It's kind of that gray space between health and a diagnosed disease, is where this is the space that we're working in when we're talking about this test. So it's a wellness tool. It's not a diagnostic test. And I think that's just important to start off with as we go through, because the language and the verbiage that I'll be using is coming from a place of functional medicine and functional nutrition. I'm a functional registered dietitian. That's my background. And so that's what I use to work with clients and customers and patients. So before we dive in, a phrase that I want to address that I'll probably use often during this video, and if you are used to working in the functional nutrition or functional medicine space, it'll sound familiar to you. And that phrase is common but not normal. And essentially, if you're not familiar with that phrase, what it means is that we're talking about a situation or circumstance that a plethora of people experience on a daily basis. It's very common, but it's not normal in the sense that it's still indicative of imbalances that are changeable. So is it going to cause this person or these people that have this circumstance serious illness or serious problems? At this point, in this moment, probably not, but it's saying that you don't have to just accept it because it's, quote, normal. It is changeable. We're talking about an imbalance. So that's largely the standpoint that we're operating out of when we're working with the results of this test, when we're talking about our customers and clients and patients. So the first section of this, when we first open up here, we see our gut score, and a couple of other pillars you'll see here. Each of these four sections are pillars that we've identified to be really important for measuring the state of the gut or gut health in general. These are all scaled on a score of 1 to 10, with 1 being the lowest and 10 being the highest. So anywhere from 1 to 3 will have a red circle around it. That indicates it's, I don't love using the term bad or poor, but that is what it's indicating, is that this is where the most room for improvement is available. If you have a score of 4 to 6 in any of these, you'll see the orange circle around it. That's basically saying you're doing okay. You know, there's definitely room for improvement, but you're got some things going on that are actually pretty supportive. So we're doing okay. Then if you have a score from 7 to 10, you'll see the green circle around it, which indicates you're doing really good. There's probably room for improvement somewhere, but ultimately you're doing a good job. So that's what those colors and the scores mean. This score in the middle is also a score of 1 to 10, and the same scoring system applies, with the 1 to 3 is poor, the 4 to 6 is okay, and the 7 to 10 is good. But this is your weighted average between the four of these pillars. So in our calculations, we do weigh some of these components to have more importance than others. Primarily the phyla balance is one that's pretty heavily weighted, as well as the pathogenic species is pretty weighted as well. So that's where we get this score from. Microbiome diversity is essentially talking about all the different types of strains and species that are present in the sample, essentially. And this is so important for measuring gut health, because studies have shown us over and over and over again that the greater microbiome diversity, or in our case, the higher the score, it's linked to better health outcomes. So that means longevity, that means fewer or no digestive symptoms, that means less chance of health issues. So it's linked to overall better health outcomes. And as you know, if you're a little bit of a gut science nerd like I am, you know that it's linked to a lot of other things in a lot of different fields, like mental health, and like I mentioned, longevity, skin issues, obviously digestive issues is one, inflammatory issues and conditions. So it's really important that we understand that the microbiome diversity is kind of a gem and an easily targeted piece for intervening if we have a gut score that's lower on the lower end, or if we have a microbiome diversity score in and of itself that's on the low end, like we see here. When you're looking at this bar, as you mentioned, these bars, depending on the sections as we go through, will look a little bit different depending on what section you're looking at. But ultimately, you'll see what we're measuring. This is either, in this case, it's the microbiome diversity. In some cases, it's a bacterial or a fungal phyla. In other cases, it's a species or a genus of a specific bacteria or fungi. We'll have an emoji that describes in picture form where the level based on the sample stands compared to our ranges. And that's in 3 levels, similar to, as I mentioned before, with poor, okay, and good. We have a sad face in red for poor. This is shown by, if the arrow is with the number on it is pointing to the red section, that's indicating the customer's sample came in at a range that is defined as less than ideal. It's bad, it's not good, we need improvement. So this little arrow points to where the customer's level was calculated at based on their sample. Then we have the orange range, which, as I mentioned, this is okay. And the emoji for that would be kind of what we see here with this one. It's not smiling and it's not frowning. It's okay. Then we have the green section here, which this is you're doing really good. And for that, you'll see this green emoji smiley face here to indicate that. We have our ranges written in text underneath the bar, so you'll be able to see not only where the customer's sample stands, but also what the range is the ideal range anyway. So when we say ideal, we're talking about the green section only. All right. The phyla balance. Phyla is just a word for a group or family of bacteria and fungi in the gut. And so the reason that this is important is because we want to see how the phyla or groups of bacteria and fungi in the gut are present in relation to one another. So if we think of the gut, the way I explain this to my customers and clients is that if we think of the gut as a parking lot, we have a certain allotted number of parking spaces. Ideally, we want Bacteroidetes and Firmicutes to take up the majority of those parking spaces, and Proteobacteria to only be taking up a small sample of those parking spaces. But if we see that some of these are off balance, and sometimes you might see Bacteroidetes being really low, it's not taking up enough parking spaces, then because of that, you may see something like Proteobacteria being really high and taking up more parking spaces than we want. So that's just an analogy that I use, but feel free obviously to use your own that you think are more explanatory. Then we have, so before I get into what these each are, I want to, because these ranges look a little bit different than what we were talking about with microbiome diversity, because this is measured in integers, these are measured in percentages. So an easy way to understand this, if we go back to my parking lot analogy, is that the Bacteroidetes, the Firmicutes, and Proteobacteria are all bacterial phylums. They are groups of bacteria. And they are the three major groups of bacteria that are present in the gut, or that we expect to take up those parking spaces in the gut. So you'll notice that every time the percentages for Bacteroidetes, Firmicutes, and Proteobacteria will add up to 100%, or at least very close to 100%, because we're working with really small numbers here. So it's possible you might get like a 99 point something 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 if you were to add them all up. And it's only because we only go 4 decimal places out. So anyway, these add up to 100%. The Ascomycota phylum is our major and only fungal phylum that we're really concerned about in the gut. So this one you'll see will almost always come out at somewhere between 95 to 99%. I have seen some reports that show it at like at high 80s, mid to high 80s, and clinically that's not really relevant for me as a registered dietitian, only because it's the only major fungal phylum that we have well studied at this point in time. So we don't really know what the implications are yet if the gut has a different fungal phylum that takes up a larger amount of space than what we've found to be ideal. But clinically, it's not necessarily super important at this point in time. I think it will be in the future for sure as we continue to get more research done and learn more things about the gut microbiome, which is always changing, but for now it's not necessarily clinically relevant. So we have our percentages. Then we have the ideal range at the bottom. So again, we're talking only about the green section here, and these are in percentages. So what this is saying essentially, if we go back to my parking space analogy, is that Bacteroidetes is taking up about 24% of those parking spaces. And because the arrow is pointing within the green section and we have the green emoji, that's right within exactly where we expect the Bacteroidetes, or that's the correct amount of parking spaces that we are expecting the Bacteroidetes to take up. It's within the normal range. Firmicutes, however, is only taking up about 18.5% of those parking spaces, which, as you can see, because the arrow is pointing in the orange section of the bar, is lower than the ideal, which here we have listed to be between 24.5 and 47.5% of those parking spaces is what we consider to be ideal. And the same pattern follows with Proteobacteria. It's taking up 54.6% of those parking spaces, which if you look below, we really only like Proteobacteria to take up about 5.6% of those parking spaces. So the Proteobacteria is very high. This is actually a pretty common finding you'll see in the reports is elevated Proteobacteria. And I'll get to what that means in a second, but that's just important to know that it's a very common finding. Okay, was there anything else I wanted to say about that? Maybe, but when it comes back to me, I will make sure to go into that. All right, let's talk about some clinical implications of what these things mean and kind of how you can pull together pieces and insights from the questionnaire, from your customer and client when you're looking at this. Because this section alone, we can tell a lot just from looking at this section alone. So the way that I explain this to customers and clients when I'm going through these reports is that this is kind of a giant overview, the top half of the report, when we look at the gut score and where they stand in all these four sections and the phyla balance is really taking a huge step back from the gut and getting a giant overview of where the customer's gut stands. And so I explained a little bit about how this top section works. This is where we can get a little bit more detail, but in a very generalized way. Ultimately, Bacteroidetes is our group of bacteria that's responsible for fermenting on carbohydrates and fibrous foods in the diet. And we also want to remember that when we're looking at the reflection of these phyla, uh, it's a reciprocal relationship with the diet, right? So what we see in this report is going to reflect the diet of your customer who you took the sample from, or who, the sample was tested from, and vice versa. If they were to change their diet, we also then may see those changes reflected in this report as well. So the gut both responds to food stimuli and also can be indicative of the typical dietary patterns. So as I mentioned, Bacteroidetes is responsible for fermenting on carbohydrate and fibrous foods. So I often see this when I see it in the low range, below the ideal range. That usually indicates to me that the person is maybe not consuming enough carbohydrates. They may not be getting, and when I say carbohydrates, it could mean fruits and vegetables, but more often than not, it actually means the prebiotic foods. So we're talking resistant starches, we're talking beans and legumes, we're talking oats. So some common examples of when you might see that, and when I see it quite often, is if someone's on a no carb, a low carb diet, like a keto diet or a paleo diet or the Atkins diet, which is a little outdated. I don't know that I've seen anyone who's on that diet anymore, but it's, they pop up from time to time. So you might see that, and in that case, you might find that the Bacteroidetes is low. The Bacteroidetes levels can also be low when proteobacteria is really high. So this person is probably getting enough fiber in the diet to be able, despite their high proteobacteria levels, but that's a common pattern that you'll find in these reports is low Bacteroidetes and elevated proteobacteria. And that's simply because proteobacteria, and I'll talk more on this when we get to them, but proteobacteria is what I call the greedy guys. If there is space and food in the gut for them to ferment on and colonize, they certainly will. And they will push everyone out to be able to do that. They are greedy and kind of like bullies in the gut. So if proteobacteria is really high and there's not enough food or space for the Bacteroidetes to grow and thrive, and the same for Firmicutes actually, then it can suppress these levels despite whatever your customer or client is eating and drinking. But that is a common example of when you might see Bacteroidetes being low. You might see Bacteroidetes on the higher level when the person is eating a really high carbohydrate or very high fiber diet. I've seen this in athletes when they're preparing for competitions and marathons and things like that, where they have to do things like carbo load, which is essentially just eating a ton of carbohydrates in a short period of time. Or if someone just follows a very high carb diet in general for a long period of time, you may see that reflected in this report. You also may see Bacteroidetes on the higher level if you have customers or clients where you suspect SIBO, small intestinal bacterial overgrowth, is an issue. And again, that's because, remember, the Bacteroidetes ferment on food. So if there's a lot of fermentation going on, there's a lot of gas that's being produced in the gut. The more carbohydrates we eat, the larger it feeds the Bacteroidetes, and therefore the more fermentation is going on and the more gas is being produced. So sometimes that's what produces those symptoms that you find in people who are struggling with something with SIBO or SIBO-like symptoms, is just simply because there's too much fermentation going on. So again, this test is not diagnostic. This is a wellness tool. So we certainly cannot tell if someone actually has SIBO based on this test. There are other tests out there that will do that. But this test is simply just saying, hey, we're seeing the imbalance here, and here's how you can fix it. So, but I have seen, maybe you might want to, when you're talking to your customers and clients, you can say, these are the patterns that exist in literature, and also based on the plethora of people who have taken this test. Firmicutes is our phylum of bacteria that's responsible for fermenting on fats. So just like Bacteroidetes is responsive to the carbohydrates and fibrous foods in the diet, Firmicutes is responsive to the fats in the diet. So when we see a Firmicutes level that's low, it may indicate that the person isn't consuming enough fat in general, or maybe isn't consuming enough healthy fats. I also find that I find this in a small subset of people who kind of were in their adult prime in the late 80s and 90s, when fat was really villainized in food and diet products were really popular. It's kind of a hard messaging to kind of unlearn. So some of them are still sort of stuck in that space, and they're the ones that are consuming a lot of diet products and no fat products, and instead they're consuming probably a lot of sugar instead. But I have seen a couple of instances where the Firmicutes, I believed, was low because that they were consuming mostly those kinds of products in the diet. When Firmicutes is elevated, could be associated with somebody who eats a lot of fast food. For example, there's a lot of inflammatory oils that come in processed food and fast food, and so the saturated fat content or intake, or just fat intake in general, is probably a lot higher than your customer or client realizes, because of those oils and things being fried and things like that. This also might be high, even I've seen this happen a handful of times in my vegans, because we're not just talking, when we talk about Firmicutes and it being high and having too much fat in the diet, a lot of times people are focusing on the unhealthy fats, or the saturated fats, the unhealthy fats, like I just mentioned, fast food and meat intake and things like that. However, we have to remember that a lot of our vegan alternative dairy products are coconut based. So our coconut based yogurts and our coconut based kefir, or because vegans aren't eating other things, coconut is a lot of substitute for other things, especially if they're happen to be vegan and gluten-free. They might be baking with coconut flour and things like that. So because coconut is mostly a saturated fat, if their saturated fat intake is high in general, regardless of the source, you may find that their Firmicutes levels are high as well. So those are some instances to look out for, insights that you can talk to your customers and clients about based off of these numbers alone. The other important thing about Firmicutes is that this is the phylum that contains a lot of our short chain fatty acid producing genera of bacteria. So essentially, if you're not familiar with what short chain fatty acids are, they are the fuel for the cells of our gut lining. So we have certain bacteria in our gut that actually produce these short chain fatty acids, and they're used to fuel the cells of the gut lining to function properly. If we have the right amount or an adequate amount of short chain fatty acid producing species in the gut, it helps prevent things like leaky gut, which can then, as we know, lead to things like SIBO, or digestive issues, or skin issues, or inflammatory autoimmune issues. So it's really important that Firmicutes is in the ideal range, and we will be able to tell kind of what specifically needs to be worked on as we get further through the report. But that's another reason why Firmicutes is so important. Bacteroidetes and Firmicutes, we expect to make up the majority of the gut, as I mentioned before, take up the majority of those parking spaces. We expect, as you can see, based on the bars, we expect the Bacteroidetes to be higher than the Firmicutes. So our Bacteroidetes to Firmicutes ratio should be, this is a decent ratio, in that the Bacteroidetes to Firmicutes is higher, But sometimes you'll see it opposite, you'll see it reversed. And some patterns that are associated with that are a standard westernized diet, like I mentioned, fast food, high saturated fat intake, and low vegetable intake. But another pattern that you might see is in people who are overweight or obese. Research has confirmed over and over again that if we find an elevated Firmicutes to Bacteroidetes ratio, it is associated in a lot of cases with those who are overweight. So that's just a little clinical pearl of wisdom. Maybe weight loss is indicated for your customer or client, maybe not. It's up to you to determine based on their biometric data. But that's just another pattern I think is important to know based on how these two phyla relate to each other. Our proteobacteria phylum is essentially our indicators of inflammation and imbalances in the gut. Whenever proteobacteria is out of balance, whenever it's high, we automatically know there's inflammation and imbalances elsewhere in the gut. We may be able to look at this and see immediately where some of the imbalances are just by looking at the levels of Bacteroidetes and Firmicutes, or we may have to do further exploration when we go deeper into the report, as we're going to do in a few minutes. But essentially, when proteobacteria is high, in any case, it's indicating inflammation and imbalances. This is a really common finding in these reports, like I was mentioning before, and I think it just goes to speak for how many people are walking around with low-grade inflammation in their gut. And it's important because a lot of your customers and clients will complete this kit, want to do this test because they're struggling with something. They have digestive issues, they have skin issues, they have inflammatory conditions, or you will have the handful of people who are just curious and, want to improve their gut health if they can. But the majority, I think, will be coming probably because they're dealing with something. And so the proteobacteria being elevated is indicative of inflammation and a lot of conditions, as we know. Unfortunately, the root cause is inflammation. So this can be linked to a ton of issues your customer and clients may be experiencing. A lot of times I see people who are experiencing digestive issues and skin issues in particular, and autoimmune issues too. They will have elevated proteobacteria show up on their kit, on their gut test. So that first part of the test is more of a big overview. We can get a lot of clinical pearls from just this section alone, as I mentioned, and as I gave some examples. But really where the nitty-gritty lies is we want to go into even more detail by looking at the beneficial species and the pathogenic species. So, I forgot to mention earlier that you'll see that some of these bars have 2 red sections and 2 orange sections, and you'll see some of them only have 1 red section, 1 orange section. And essentially what that means is what we're saying when we see a bar like this, like Akkermansia mucinophylla, we're saying that it's possible that this genus of bacteria could be too high or too low, and if it is, we may want to do something about it. So there's 2 potential, essentially, possibilities where we may want to intervene for some of these things on this report, whether it's a genus of bacteria or fungi, or it's a phyla itself. So the same thing for Bacteroidetes. If it's too high or too low, we may want to intervene. With Firmicutes, if it's too high or too low, we may want to intervene, or we want to intervene most of the time. Whereas when we compare this to proteobacteria, we're really only concerned clinically if it's too high. Otherwise, we don't really care. The person's doing good. And it's the same for a lot of these beneficial species that we'll see listed, like Bifidobacterium. We're really only concerned if it's too low. We only want to intervene clinically if it's too low, if it's below the ideal range. And it's the opposite with the pathogenic species, with a number of pathogenic species, right? We really only want to intervene if it's too high. And the way you can tell if we're concerned if it's too high or too low is if the red section of the bar is on the right side, that would be a genus of bacteria or fungi where we only want to intervene if it's clinically, if it's too high. We only really care if it's yeah, if it's too high. Whereas if you see the red bar on the left-hand side, then that means that that specific genus of bacteria or fungi or phyla, we really only want to clinically intervene if it's too low. So that's just a brief thing I forgot to mention earlier that might be of help for understanding some of this to some people watching. But the beneficial species is, now these are of course not the only beneficial species that we test for, and these species in particular are our anti-inflammatory, our protective species that have been shown in research to be the most important for our overall health. So we certainly test for other species that can be considered protective or anti-inflammatory, but we chose this handful to display because they are the most important, A, for clinical interventions, and B, they're the most well researched. Also, a side note, when I say, I'll use the word species interchangeably with genus in this video, and that's not because I'm unintentionally using the wrong verbiage. It's just for ease of language and communication for a wide variety of practitioners who may not be involved in the gut health space. So if you are a gut health connoisseur and have noticed that I'm misusing the word species, please forgive me. I know it's more just for communication for a wide variety of practitioners. But anyway, this section is going to tell us, it's pretty self-explanatory. It's going to tell us where we stand with this group of protective or anti-inflammatory species that we are interested in, and this can really help guide your clinical interventions. So you'll notice that we have a lot of our short-chain fatty acid producing species listed here, like our Faecalibacterium prausnitzii, which is super, super, super important. We have Pichia, which is a really important protective fungi, as well as Saccharomyces cerevisiae and Saccharomyces spp. For those of you that don't know, Saccharomyces, when we see this SPP following a genus name, it's essentially talking about, what it's saying is we are encompassing all the different types of Saccharomyces within this bar. So this bar is telling us how much all the different types of Saccharomyces, how much space all the different types of Saccharomyces are taking up in the gut. Whereas Saccharomyces cerevisiae, for example, this bar specifically is telling us how much space Saccharomyces cerevisiae specifically is taking up in the gut. And Saccharomyces cerevisiae is a subset of Saccharomyces spp. So just in case you're not well versed in the gut space just yet, that's what that means. Bifidobacterium, we're talking about all the different genera of Bifidobacterium that are composed in that. And the reason we separate out some more than others is because we thought perhaps it could be clinically relevant for you. With the example of Saccharomyces cerevisiae, this is the only beneficial yeast that we find in the diet. It's in brewer's yeast. So it could be helpful for your clinical interventions to see where Saccharomyces cerevisiae stands versus all the different kind of Saccharomyces. So that's just an example of that. Okay. Speaking of interventions, this is kind of, I cannot stress this enough because I think this is a really common thing that I talk to with customers and clients when I go through this report, is that you will often find people having digestive issues, having skin issues, having inflammatory issues, having all kinds of host of discomfort. But you may find their proteobacteria is not that crazy high elevated. Maybe it's like 10% instead of 5%. Maybe the rest of the Bacteroidetes and Firmicutes are pretty in balance. Maybe they're like this report and they don't have really any overgrown pathogenic species. But they're still really uncomfortable and they want to know why. And most likely the reason is because their report may look just like this one, meaning we have frowning and okay faces in all of these protective and beneficial species section. And essentially what that means is it can cause problems in certain people just to not have enough beneficial or anti-inflammatory bacteria and fungi in the gut. If you think about, I'm going to use another one of my analogies that I used to talk to my customers and clients, is that if you think about your gut as a castle that you want to defend and keep safe and well functioning, you may place some guards outside to ward off any intruders that might be trying to get into your castle. But your 2 or 3 guards that you put outside are going to be no match for an army that suddenly happens upon your castle. So what's happening here in this case, as we see here, is that this person just simply doesn't have enough of the good guys, especially in the presence of a normal level of commensal or opportunistic bacteria and fungi. Opportunistic, for those of you who are unfamiliar, just means they can go either way. They're a normal part of the gut microbiota and mycota, but if there is space in food to grow and thrive, they will overgrow and cause problems. So having enough protective bacteria and fungi in the gut is a huge priority in our diet and lifestyle recommendations for that reason specifically. And when you're talking about, or when you're looking for clinical pearls and interventions, you can check the clinical interpretation guide that I created to help you with like specifics of these species. But I'll just give you a couple examples. Is that unfortunately a lot of these are not found in the diet. Really, the only way we get, for example, bifidobacterium and lactobacillus is through cultured and fermented foods like kefirs and yogurts, or cultured dairy alternatives, things like kombucha or fermented vegetables, right? So they're really kind of limited in the diet. And like I mentioned, brewer's yeast for Saccharomyces cerevisiae. But that's kind of the only direct way that we get probiotics or any of these bacteria and fungi from the diet directly. Research shows us that actually the best way to improve this section of the report is by including those probiotic and fermented foods daily. Of course, that's always going to be beneficial. But then we also have the matter of prebiotics, specific prebiotics in the diet. So we're talking beans and legumes, we're talking oats, we're talking apples, we're talking bananas, we're talking resistant starches like sweet potatoes with the skin on, plantains. We're talking all of those specific prebiotic foods, your FODMAPs essentially. And I'll tell you, those in particular feed Faecalibacterium prausnitzii. This Faecalibacterium prausnitzii loves our fructooligosaccharides in the diet. So, and when Faecalibacterium prausnitzii is happy, usually our Akkermansia muciniphila is happy. So that's kind of an example of how when we feed and boost and support one or a few of these bacteria and fungi that are listed here, we can feed and support the group or the gut as a whole, because some of them feed others. Or in particular, another helpful tip for your clinical interventions is Akkermansia muciniphila loves red polyphenol foods. So that's a really good, easy, low-hanging fruit intervention that you can offer to your customers and clients if their Akkermansia muciniphila is low. You'll also, one more thing about Akkermansia muciniphila before I move on. I mentioned that this is pretty much one of the only beneficial species in this section that has the range where we're concerned if it's too low, and we're also concerned if it's too high. And some of you may have questions about that. So to answer that, Akkermansia muciniphila is our mucin degrading bacteria. So it responds to the level of mucus in the stool and in the gut. Where there's inflammation, there's usually mucus. Inflammation means mucus. So if there's high inflammation in the gut, like we see here through this elevated proteobacteria, we will likely see a low or high level of Akkermansia muciniphila. When it's too high, it means there's a lot of inflammation going on and there's a lot of active Akkermansia muciniphila working to try to degrade all that mucin. You may see someone who has mucus in their stool. If this Akkermansia muciniphila is on the higher range, if it's high, when it's low, it simply just is falling in line with the pattern of in a gut that's imbalanced where there's a lot of inflammation going on. Typically, this is a very common profile of having a lower amount of protective anti-inflammatory species. It just includes Akkermansia muciniphila. So just in case anyone has questions about that, that's the explanation for that. The next section of the report is talking about our pathogenic species. And I think this is really important to review because a lot of your customers and patients and clients will be the most interested in this section, especially if they're having digestive issues. They, will be very interested in this section. So the first thing I want to point out is, again, we are not diagnosing with this test. So a common thing that I talk to about customers and clients is related to E. coli, and that's about this issue. When a lot of people see E. coli, they automatically are worried because they think it's an E. coli infection. And we have to remind our customers and clients and patients that E. coli is the genera of bacteria, meaning there are a lot of different species within that genera. There's E. coli nissl, for example, which is actually a beneficial protective species of E. coli. So this level that you see here, it's a little elevated in this report, and that could be because the person maybe had takeout a couple days or the day before they did their sample. You can get E. coli from salad bars, you can get it from eating out, you can even get it at home if someone doesn't wash their hands properly. So there's a lot of different ways that E. coli is a pretty common finding in the gut. Now, I go back to this statement of it's common but not normal. If it's elevated, it's considered common but not normal. It may not be a reason for your customer or client or patient to be upset, to freak out, but we definitely want to intervene in some way. And so thinking through it clinically, what I always do when I see an elevated E. coli in a person's report, E. coli is a member of the Proteobacteria phyla. So if that's super elevated, it's not super elevated here, but if it's super elevated and the Proteobacteria is elevated, that may be the link between where the inflammation is coming from. But the first thing I do is ask the customer or patient or client if they're having any digestive symptoms that are typical of an E. coli infection. If they're having a fever, food poisoning-like symptoms, stomach pain, diarrhea, those kinds of things, then of course I would encourage them to follow up with their doctor because that may mean an E. coli infection. That may be something that needs to be addressed by a medical provider, potentially may need medications that is outside of my scope of practice. So in that case, I would refer out for sure. But if it's a customer or a client or a patient that doesn't have any of those symptoms, they seem fine and healthy, I just usually explain to them that there is a difference in certain cases where E. coli being elevated may indicate an infection or some kind of issue, but usually people are having symptoms that are associated with that if that's the case. And believe me, you would know if you had an E. coli infection. There is no questioning that. So if we have a case like this where the person's not having any digestive issues, then I would go down my other kind of things to follow up on. Ask them, have you had takeout recently? Do you remember if you had takeout or you ate out the day before or a couple days before you did your sample? That's possibly where E. coli can come from. Are you practicing proper food safety precautions at home, cooking your food to the proper temperature, avoiding cross-contamination, hand washing, things like that? And that could be that your customer, client, or patient, or the person who's preparing their food. Sometimes it's a different person. It could also, did they travel somewhere recently that maybe they don't normally travel to, because E. coli can be found in water as well. So there's a lot of different variables on how you can explore E. coli specifically with your customer, clients, and patients. But the thing that's really important to remember here is that An elevated E. coli level in this report as we're presenting it does not automatically mean a red fire alarm and that everybody's in danger and somebody's really sick. It certainly does not mean that. We kind of have to go through our process of elimination and use our clinical judgment to figure out what the best course of action for those patients are. But it is a common finding that you'll see in our reports as well. So that's just more information for you to be prepared when you're talking to your people about their results. This is not a common finding. Usually candida levels are, it's another common finding to have our candida levels be high or elevated in the gut, particularly in women and particularly in elderly people or older women. So it is a common finding that you will see. Whether the reason we test for different types of candida is because it may help lead your clinical intervention. There's some, if you're a person who's using herbals, there may be some herbals out there that are more effective for Candida albicans versus Candida tropicalis. And these two types of candida are the most clinically studied. And as we know so far today, the biggest fish to fry in the candida gut issue universe. So that's why we chose to represent them. And again, as I mentioned, Candida SPP is talking about all the different types of candida that were present in the stool. So sometimes you'll see that Candida SPP is high, but Candida albicans and Candida tropicalis are normal. And so as a clinician, where that can lead you is that you know some kind of candida is elevated, but you know it's not Candida albicans or Candida tropicalis. So that may change what type of herbal intervention you're using if you are using herbal intervention for that. Also, it's important to just point out that in my experience, I feel like the combination of supplements and diet and lifestyle changes is the absolute best way to combat imbalances in the gut. Depending on what scope of practice you have, of course, you may feel differently and you may have other tools or modalities to be able to address that. But coming from a functional nutritionist or a functional registered dietitian like I am, I think it's translatable to a lot of different scopes of practices. And I do think that it's accessible and available for a lot of people too. So it's important to talk to your clients, patients, and customers. If you are using herbals or medications or some other tool, it is really important to explain to them that they can do those things alone, but if they continue the diet and lifestyle habits that put them at risk to have these things overgrown in the first place, they may end up with recurring issues. So I think that's an important conversation to have with our customers, clients, and patients, just because I know we all care about their results. We want them to feel better. We want them to be happy with us, with our testing, and the tools we're offering them. So just making sure that the education piece about that is happening, I think is a really helpful way to set everybody's expectations up in a really nice and supportive way. Candida, so we got Candida, Citrobacter, E. coli, H. pylori, and I think C. diff too, but I'm not 100% sure on that. All of these are what we call biofilm creators. So if you're not familiar with what a biofilm is, essentially it's a protective barrier that these microbes can form around themselves. And unfortunately what it does is it makes them harder to treat. It makes it harder for us to reach them with our interventions, whether it's herbals or medications or whatever it is that we're using, because they are able to form this protective film around themselves. So it's really important if you are using supplements as part of your protocol, that you include a biofilm disruptor in that protocol, which is usually a formulation of specific enzymes and probiotics and prebiotics. So I just thought I would mention that for those of you who are not aware of that. If you don't add the biofilm disruptor in your protocol, it might make these things a little bit harder to eradicate, because your interventions may not actually be getting to the cells of these microbes because they're protected. So I think that's really important to know too. what else here? If you have a report where any of the candidas, citrobacter, E. coli, or H. pylori, if any of these are elevated in tandem with one another, you've got a heavy, I was going to say you've got a big problem on your hands. And as clinicians, I know there really are, there are levels of severity that we are prepared to handle. And I would say that in the framework of working with this specific test, that is on the higher end of the most severe case that you will be working with, essentially, because that kind of arrangement in the gut is going to be the hardest to eradicate, the hardest to intervene. And again, it's because of those biofilms. It's because these guys are so greedy. They feed each other. So it's kind of, the way you can think about it is it's kind of like they're ganging up on the good guys here. If we have more than one of these that are above the ideal range, especially in the case of if we have a profile that looks like this, where there's just really not a lot of beneficial species present, that's, I'm just giving an example of a stronger case, a more severe case compared to a case that's maybe just requires lighter intervention, especially when we're talking about these pathogenic species. Okay, so that's the main parts of our report. The sections that I reviewed are where you're going to get the majority of your clinical, well, all of your clinical pearls from, and that's going to guide your interventions when you're talking to your customers, clients, and patients. But we do have one additional section here, which is labeled additional species. And essentially what this is we're really not, there's not a ton of bacteria and fungi in here that I find are necessarily clinically relevant at this particular time, because this is a very general wellness report. It's a wellness tool that we're offering. There's some of these bacteria and fungi that are associated with certain things. Some types of Oxalobacter formigenes, for example, can be connected with a higher incidence of kidney stones, but also can be connected with longevity to better, longer lives and healthier aging and things like that. So it just sort of depends. These are the species, or the species in genera, the taxa is a better word to say that. These are the taxa that are present in the most research that's available now, but we're just really not sure what clinical pearls we can gather from it just yet. But we do put it here in the report because we understand there are practitioners out there who have specialties and may be able to utilize some of the numbers or the values on this report, and they are well researched, and so we certainly didn't feel right about excluding them. But you will get, in general, you will get most of your clinical pearls from the sections that we went through already. So that concludes the section of this video where to go over the general overview of the report and what it means and how to read it. Oh, I think I forgot to mention one more thing. So I'll just do that really fast. The percentages, like I mentioned here, you'll notice they're a little different than the way the percentages in the rest of the report look. These are very, very small numbers in the beneficial and pathogenic species section, whereas we're looking at big numbers, big percentages here in the phyla balance. And the reason for that is because, again, we are talking about phylas, groups of bacteria. So we're talking about all the different genera and species that are in the Bacteroidetes phylum are contained in to make up this large of the percentage. But if we're looking at each individual taxa, we are talking about relative abundance. So what this is saying, for example, is that Bifidobacterium, all the different types of Bifidobacterium that we test for, is taking up about 0.1234% of the total space in the gut. So 0.124% of those parking spaces that are available. So that's what those percentages mean. I just wanted to make sure I touched on that, because that's a really common question that I get from both customers and practitioners. So I just want to go through some examples of how to kind of pull information from the actual report that would allow so that you can make your consultations feel more personal and personalized to the clients you're talking to. So what I usually do when I get on a phone with a customer, a client, or a patient is I'll ask them first and foremost, why did they order the gut report? And you working closely with your patients and clients, you may already know the answer to that. So you already know what their main concern is. But if you don't, that's what I start with, because that helps guide my interpretation of this test. So for example, if someone's coming to you and their main concern is acne or IBS, for example, you may find there's nothing in this report that's specific toward acne or specific toward IBS exactly, but you will see patterns that you can see in both. And what I mean by that is, if we take the two of them, acne and IBS are both inflammatory conditions. The root of them is inflammation. So in my head, what I'm thinking of is, okay, where do I see signs of inflammation in this person's report, and what do I suspect that inflammation may be coming from? So this person, we know for sure they're experiencing inflammation because their proteobacteria is high. If this is somebody with acne specifically, their firmicutes is low, so they may not be getting enough healthy fats to support the lipid barrier and skin health. So that may be an intervention that I suggest for them. But primarily, the intervention that I suggest is going to focus on lowering inflammation that I see here. So with acne, we also know that in the research, enhancing the gut health as far as really beefing up and preparing the resources of the gut, like our short chain fatty acid producing anti-inflammatory and protective species in the gut, is a really good intervention for that. It does help lower this inflammation that we see here, and through other mechanisms can help improve something like acne. So if we were talking about an acne client, actually my main source of intervention would really be working on this proteobacteria. And working on boosting up these beneficial species. So I would be talking to them about getting more prebiotics in the diet, about consuming more fermented probiotic and fermented foods. I would be talking to them about getting more polyphenols in the diet through colorful fruits and vegetables, and antioxidants, to make sure that all three of those interventions are feeding all of these beneficial bacteria and fungi as a whole. And once we get these into proper levels, it may help reduce some of this proteobacteria. And we do know that through other mechanisms, fermented and probiotic foods can help reduce inflammation in general too. So that would be an example of how I can kind of make this more personalized for an acne patient. Let's take the example of IBS. Again, this is an inflammatory condition. So the intervention largely would probably be the same. The only difference with the IBS is IBS can present in different forms, right? We can have IBS-D, or dominant diarrhea dominant IBS, or IBS-C, which is constipation dominant IBS. Some can have a mix of both. So I would want to know more about what their symptoms are, and that may require more tailored adjustments in the specific foods that they're eating to help mitigate symptoms. But in general, we still want to reduce the inflammation. So we still want to maybe include some mucosal healing foods or herbs and spices in the diet, antioxidants. Healthy fats is another way to reduce inflammation, and also for this person it would be good because we want to get this firmicutes level back in normal range as well. And again, we do know in the research that supporting these beneficial protective types of bacteria and fungi can also help improve IBS. So those are examples where I was mentioning earlier about how customers, clients, patients will come to you for a variety of different reasons. But if you can kind of pinpoint the underlying main root cause of what that issue is that they're coming to you for, especially if it's inflammation, which largely the root of most things is inflammation. So we're in luck that we have a tool here to really tell us, to really confirm that inflammation is happening in the gut and give us more insight about what we can do to help reduce that inflammation. So to reiterate, some strategies to reduce inflammation when proteobacteria is high, that's indicated by high proteobacteria, I mean, first things we really want to pay attention to are balancing out the major phyla, the Bacteroidetes and Firmicutes, boosting the beneficial species, and reducing the pathogenic species. So those are kind of the umbrellas that you can work off of within the container of reducing inflammation. And within the insights, we do have options for how you can do that. We do talk about including more anti-inflammatory and mucosal foods in the diet. We do talk about including supporting your diet with prebiotics and probiotics specifically. We do talk about increasing polyphenols and fruit and vegetable intake for the sole purpose of reducing inflammation. Okay, so I have a couple of other examples to go through. Let's see. This example is if most women over 35 have high candida and low akkermansia, why is this normal but not optimal? And that just goes back to what I was saying about these are really common findings you'll see in the gut report. Like I mentioned, having elevated candida, having low beneficial species, Akkermansia muciniphila is one of those, is a really common but not normal finding. So it's not optimal because these are really important pillars of setting your gut health up to function properly. So while you may have a plethora or a handful of customers, clients, and patients who present with these things, it does not mean they're not changeable. They are changeable, and you should absolutely intervene with hopefully diet and lifestyle primarily. But if you want to use herbals or other tools and modalities to do that based in your scope of practice, then of course. If someone has high proteobacteria, does it mean they likely have SIBO? So as I mentioned, SIBO, we are not diagnosing with this test, but some common patterns that you'll see alongside SIBO, the patterns that I see are overgrown or high Bacteroidetes, high proteobacteria, and a plethora of digestive symptoms. Usually those symptoms include things like heartburn, bloating, gas, and a kind of a back and forth between diarrhea and constipation. Stomach cramping can be a part of that sometimes too. So there's no one single thing or pattern in this report where we can say, oh, this person has X, Y, and Z. That definitely means they have this condition, because that's what diagnostic tools do, and this is not a diagnostic tool. What we're doing is we're simply connecting the dots and saying, okay, I'm seeing this imbalance, and this imbalance, which I usually see in people with this type of condition. But you're not actually treating the condition. You're not actually working based off of the condition. You're working based off of the imbalances that you see in this report. So if the Bacteroidetes is high, you're going to make your intervention based off of the fact that the Bacteroidetes is high, not necessarily that the person may or may not have SIBO, because we don't know that. It's just working off of the imbalances alone. So there are patterns that I see and that you'll see. I gave the example of the SIBO pattern in particular, but the interventions that we use are not necessarily because of the diagnosis of SIBO. We're working based off of the of the imbalances that we see in the report. What bacteria would suggest parasitic activity? Typically, some people may have symptoms. And some people may even see the parasites in their stool. So they may come to you and be like, I don't know, I saw some crazy stuff in my stool. And in that case, that's kind of a big indicator that there may be parasitic activity in there. But the overall pattern that may suggest parasitic activity in the gut is if your defenses are down. So we're talking the pattern of having low beneficial species and either high normal or higher levels of the pathogenic species. Our bodies are supposed to have the defenses in place to fight off these parasites that we encounter every day. We encounter parasites when we eat produce. even if we wash them, we encounter them. We encounter them in our environment by being around animals, by all kinds of things in our environment. But our body is supposed to have the defenses to fight these parasites off, to get rid of them on its own. But if we have parasites, it's an indicator that our body's defenses, particularly in our gut, are not functioning properly. And a sign and signal that goes along with that pattern is if we have higher than ideal numbers of specifically of our pathogenic bacteria and fungi in the gut, especially when it's combined with low protective anti-inflammatory bacteria and fungi in the gut. So really what we're doing, in conclusion, what we're doing with this test, the way that I think this test is the most helpful, both for you and for your customers, clients, and patients, is moving away from, well, not moving away, because for many of us, and myself included, diagnosing and diagnostic practicing is not in my scope of practice. So we are not doing that, but what we are doing is identifying patterns and making connections between the person's symptoms, what they put in their lifestyle questionnaire, which is why it's so important to review how and ask them to confirm how they're sleeping, how often they're stressed, how does that stress feel to them, how often are they moving, what kind of diet are they currently eating, do they eat fast food, how many cups of fruits and veggies do they have typically. So it's important to kind of take information from their questionnaire and use that to kind of tie in to their gut test to connect the dots. And we provide helpful insights, diet and lifestyle and product considerations to help you and them do that. So in each report, you'll see two diet recommendations, 2 lifestyle recommendations, and then product considerations. And these things are, remember, we choose these because we're working off of what the gut report says and what the questionnaire says. So we often don't have the very detailed, highly specific information that you may have because you talk to your client and customers and patients in person. You may have more of that information. But if you are a practitioner who's doing consults with this test, you also may be in the same position that we are in when we're doing these. So you can also, if you find that some of these recommendations aren't necessarily the most helpful for your client, customer, or patient after you talk to them, you can always just let them know, hey, after I've spoken to you, I think this would be a much better approach for you to take. Just try to, ignore this recommendation and try this instead. And you can verbally let them know that. So that's another good way. You don't necessarily have to rely fully on what's here. We have arranged it and designed it in a way that it's supposed to be helpful to you in your practice and help guide your clinical interventions and translate the information that we get in the gut test into tangible, actionable steps for your customers, clients, and patients. But of course, keep in mind, we're operating not being able to speak to them, only being able to go off of what we see in the gut report and what we have from the lifestyle questionnaire. So use your clinical judgment. This is meant to be a guide, and we do the best we can, but sometimes you may find there are interventions that might be more helpful for the person you're talking to. Let's see. So I believe that would be, is there anything else that I want to say about, I guess I'll just go over this really fast. These are your insights. These are what you and your customers, clients, and patients are going to see in addition to their gut report. And like I said, these insights that are generated are pulled from information that's in their gut score or their gut report and their questionnaire. You will see a couple of these repeat a lot because a large part of the population have these circumstances where we think these recommendations are really important. Stress management is one of them. You will see this recommendation all the time, and that's probably because most people are stressed. You'll see the gut healing recommendation because most people will have elevated proteobacteria to some level, and that indicates gut healing in some way. You'll see increased fruits and vegetable intake because most people don't eat enough fruits and vegetables. You'll see that a lot. You'll see the increased probiotic fermented and cultured foods recommendation a lot because a lot of people don't have the microbiome diversity that we think is ideal, and or they have elevated proteobacteria and other criteria that we look for. So you'll see a few of these repeated a lot, and just keep in mind it's simply just because a lot of our population has similar problems. And what we're looking for, and when we design these recommendations, is we really wanted low-hanging fruit, things that are easy and actionable for people to implement in their lives, because we've found that that's the most successful way to help support our customers, clients, and patients with making real, effective change in their life and in their gut health. The product considerations are at the bottom, and again, these are based off of what we think is clinically relevant and important, but based off of the information we have. But of course, as their practitioner or as their nutrition consultant, for sure, based on what they say when you talk to them, you can always tell them to change these out, or if you have recommendations that you think would support them better. That is it. I hope that this has been a helpful way for you to just kind of clinically become prepared to talk to your customers, clients, and patients about the gut test. And I hope I'm really excited for you. This is a really very cool way to put the health information directly in the hands of consumers. And a lot of people find it really helpful and really useful in changing their lives. So thanks for joining me.